Delta Community College ADN News. My name is Portia Meeks and I am a student nurse at Mississippi Delta Community College. And today's segment will be about breast cancer. This segment will be provided by your 2021 Mississippi Delta ADN nursing students. We will have two segments on today about breast cancer. The first segment will be about much needed facts, helpful tips, and great needed education about breast cancer. The second segment will be about the benefits and the treatments of breast cancer. So let's get started.
I'm Sabelle Dewitt and I'm in the ADN program at MDCC. In this portion of the video, I'm going to be explaining to you what breast cancer is and some general stuff about it. So, what is breast cancer? Breast cancer is when malignant cells form and grow in the breast tissue. So, that breast tissue mostly consists of adipose tissue and lobes, lobules, and milk ducts. In those lobes, lobules, and milk ducts, that tends to be where most cancers begin to form. And then it has a high rate to metastasize because it can spread to your lymphatic system and go all over your body. And that is what metastasize means. Another fact is that men and women are both affected by breast cancer. In men, they have a higher mortality rate because they tend to not report their signs and symptoms, and their cancer tends to form behind their nipple or areola. Tumors are another thing that happens with breast cancer, and to determine if a tumor is cancerous or malignant or benign, which is what you want, they're going to do a biopsy to determine the aggressiveness of this cancer and the severity of this cancer and determine treatment options. Another thing that they can do for prevention purposes is do some genetic testing for the BRCA1 and BRCA2 gene in both men and women, and it tends to have a correlation with the formation of breast cancer done in studies throughout the years. If a male happens to carry the BRCA1 or BRCA2 gene, they can develop other reproductive cancers they've shown in studies, such as prostate cancer. Thank you.
Thank you, Savelle, for that wonderful information. Now we will have information provided on the different types of breast cancer.
Hello, my name is Letitia Young and I'm a student from Mississippi Delta. Today I'm going to talk with you about the different types of breast cancer. Before I get started, I want to go over a couple medical terms that people often get confused. Benign is non-cancerous, malignant is cancerous, and carcinoma is the overgrowth of epithelial cells that line organs. On to the types of breast cancer. The different types of breast cancer include ductal breast cancer, which starts in the breast ducts, and that is the part of the breast where the milk travels. Lobular breast cancer starts in the lobes of the breast, and that is the part that is responsible for the milk production. Paget's disease starts in the nipples and is commonly marked by symptoms including itching, burning, and eczema-like condition around the nipple, sometimes accompanied by oozing or bleeding. Phyllodes tumors are rare that occur in the connective tissue of the breast. These tumors are more common in premenopausal women and can be benign or malignant. Inflammatory breast cancer occurs in the skin of the breast. Unlike other breast cancers, often this form of breast cancer does not have a lump. Some less common breast cancers are colloid breast cancer, and this is a form of invasive ductal sarcoma that makes mucus and is typically less aggressive. Medullary or medullary breast cancer is a rare cancer, and it resembles the color of the brain tissue under a microscope. It is usually triple negative, more common in women with the BRCA mutation, and is usually less likely to involve the lymph nodes. Tubular breast cancer is a type of invasive ductal sarcoma made up of tube-like structures and it tends to be small and slow growing. Thank you.
Thank you, Letitia, for that information as well. Now, let's learn about the signs and symptoms.
My name is Kenyatta White, and I'm a student nurse at Mississippi Delta Community College. And today I'm going to discuss the signs and symptoms of breast cancer. There can be many signs and symptoms of breast cancer, such as swelling, redness, or other visible differences in the breast, increase in size or change in shape of the breast, any discomfort, pain, or itching of the breast or nipple. They may feel hard, tender, or warm. There can be maybe a lump or swelling in the underarm of the lymph node. And here are a couple of pictures of some of the different signs and symptoms, such as dimpled or depressed skin. As you can see, the breast has a dimple in it. Visible lump. There's a lump on this side of the breast. Nipple change examples are inversion, whereas the nipple is going inward instead of outward. Bloody discharge, there's blood leaking from the nipple. Texture change, so there's different changes in the breast, such as the texture. Color change, there are different changes in the color of the breast. They may become darker or something like that.
Great information, Kenyatta. Now, let's hear about the stages of breast cancer.
Hello, everyone. My name is Jakaya Jones, and I'm here today to talk to you all on the stages of breast cancer. There are 4 stages of breast cancer, which with each stage having more than one subcategory. So, stage 1 itself means that the cancer has formed, but stage 1A means that the cancer has not yet spread outside the breast, and the tumor is 2 centimeters or smaller. In stage 1B, small cluster of breast cancer cells are found in the lymph nodes, and either no tumor is present or the tumor is 2 centimeters or smaller. Stage 2, you have stage 2A and stage 2B. With stage 2A, it is defined as either a tumor between 2 to 5 centimeters without any cells having spread to the lymph nodes, or no tumor is present at the breast, but there are cancer cells in 1 to 3 axillary lymph nodes or the lymph nodes near the breastbone. In stage 2B, it is defined as either being between 2 to 5 centimeters in size and small cluster of breast cancer cells that are found in the lymph nodes. The tumor is between 2 to 5 centimeters in size, and cancer has spread to 1 to 3 axillary lymph nodes or to the lymph nodes near the breastbone. So with stage 3, you have A, B, and C. With stage A, the tumor is larger than 5 centimeters and small clusters of breast cells are found in the lymph nodes. Or it could be that cancer has spread to 1 to 3 axillary lymph nodes or the lymph nodes near the breastbone again. Or the tumor may be any size and the cancer cells are formed in 4 to 9 axillary lymph nodes in the lymph nodes near the breastbone. In stage 2B, you have the tumor may be any size and cancer has spread to the chest wall or to the skin of the breast, caused swelling by an ulcer, which would be called the inflammatory breast cancer. In stage 3C, the tumor may be any size and cancer may have spread to the skin of the breast, caused by swelling and or ulcer, and has spread to the chest wall also. And the cancer could have been spread to 10 or more axillary lymph nodes above or below the collarbone, or axillary lymph nodes, or lymph nodes near the breastbone. So with stage 4, that is any spread of breast cancer outside and draining lymph node regions is considered metastatic breast cancer. So with metastatic breast cancer, that means that it has spread to other.
Great information also, Jakaya. Now, let's hear how and where breast cancer spreads.
Breast cancer is a cancer that is formed in a cell of the breast. Over 90% of breast cancer deaths are due to the spread of the disease, which is called metastatic breast cancer. It is the most advanced stage of breast cancer. Metastatic breast cancer is a breast cancer that has spread beyond the breast and nearby lymph nodes and other organs in the body, most often spread to the bone, lungs, liver, and brain. Metastatic breast cancer is treatable but not curable. Researchers are not sure why breast cancer metastasizes, but early detection is key.
Thanks, Jasmine, for that wonderful information that you have provided. Now we will hear about the nutrition for a woman with breast cancer.
Hi, my name is Breon Smart, ADN student from Mississippi Delta Community College, and I'm going to provide you some information about nutrition during your cancer treatment. The first thing to remember during your cancer treatment is that you need to increase your protein. Protein is responsible for the building and repair of tissues. Protein is usually increased by 1/2 gram per pound of body weight. Next, you would want to consume adequate amount of calories to prevent any weight loss, any excessive weight loss. Next, you would increase your amounts of fruits and vegetables that are consumed during the day, usually between 10 to 15 servings a day. And you want to choose a variety of options, and always think of the colors of the rainbow when consuming these, as their colors are related to the different vitamins and minerals that they contain. And they also help with preventing constipation. This is just a few tips to help you remember during nutrition consumption during your treatment. And remember that nutrition matters.
Thank you, Breon, for that information. Now we will have a special segment on sports following a public service announcement on COVID.
Thanks, Portia. Hey, everybody. My name's Shelby, and I'm here to talk to you about the coronavirus pandemic that we have been experiencing since the beginning of this year. The CDC still requires us to wear a mask and stay 6 feet apart. And if you are showing any symptoms of a fever, maybe a cold, loss of sense of taste and smell, nausea, or vomiting, contact your healthcare provider so they can have a treatment plan set up for you as soon as possible. I hope everybody stays safe out there. Y'all have a nice night.
Hello, my name is Cortavia Mack, and I am a student nurse at Mississippi Delta Community College, and I will be talking to you all about breast cancer awareness in its relation to sports. Starting out with Major League Baseball. By 2005, Major League Baseball was letting fans donate money for every strikeout, with the proceeds going to breast cancer charities. By 2006, Major League Baseball players were playing with all pink bats, and afterwards they auctioned off the bats to raise money for breast cancer. Since 2004, Major League Baseball has raised millions of dollars for breast cancer while being partnered with the Susan G. Komen Cancer Foundation. Moving over to the NFL. The NFL joined the fight to help raise awareness for breast cancer in 2009. During the month of October, players and coaches wear their all pink gear from pink gloves to pink socks to help raise awareness. Moving over to the WNBA. The WNBA was founded in 1996, and by 2001, they were doing their part to help raise awareness for breast cancer. The WNBA holds their breast cancer awareness games in the month of August as part of their WNBA Fit Month. They use that time to wear their all pink gear to raise awareness for breast cancer. The WNBA also offers a screening tool that helps screen for the risk of breast cancer. They have helped over thousands of people get free assessments so far. Shifting the focus over to COVID-19 in its relation to sporting events. When attending sporting events, you want to be sure to do things like wear your mask, of course, social distancing, keeping 6 feet apart, and limiting physical contact with people you didn't arrive to the game with. Wash your hands and limit contact with frequently touched surfaces. Safely eat and drink your food, and safely support your team. Thank you.
Thank you for the great facts and education, Cortavian and Shelby. This now concludes the first half of this segment on breast cancer. I will now be turning it over to Shelby.
Hey everybody, my name's Shelby, and thanks for tuning in to the second portion of Mississippi Delta student nurses teaching you about breast cancer. We're now going to learn about a couple more facts about breast cancer.
Hello, my name is Alex Santucci, and I'm here to tell you a few important facts on breast cancer. 1 in 8 women in the United States will develop breast cancer in her lifetime. That's 12% of women. Although it is rare, men get breast cancer too. Breast cancer is the most common cancer in American women except for skin cancers. Breast cancer is more common in the left breast than it is in the right breast. On average, every 2 minutes, a woman is diagnosed with breast cancer in the United States. Most women, about 8 out of 10, who get breast cancer do not have a family history of the disease, but women who have a close blood relative with breast cancer have a higher risk. Having a first-degree relative like a mother, a sister, or a daughter with breast cancer almost doubles a woman's risk. Another top risk factor for breast cancer is simply getting older. As you age, your risk of breast cancer goes up. Most breast cancers are found in women aged 55 and older. Women who have had more menstrual cycles because they started menstruating early, especially before the age of 12, or went through menopause later after the age of 55, have a slightly higher risk of breast cancer, likely because of a longer lifetime exposure to hormones estrogen and progesterone. According to the National Institutes of Health, breast cancer survivors are at an increased risk of osteoporosis. Estrogen has a protective effect on bones, and reduced estrogen levels can trigger bone loss. There are over 3.5 million breast cancer survivors in the United States. So be sure to get your mammograms done and perform monthly breast exams.
Thank you, Allie, for that great information on facts about breast cancer. We're now going to tune it to Miss Portia and talk a little bit more about mammogramming.
Hi, my name is Portia Meeks, and I'm a student nurse at Mississippi Delta Community College, and today I will be providing information on mammograms. A mammogram is an X-ray picture of the breast that is used for screening and diagnosis of breast cancer. Women aged 45 to 54 should get a mammogram yearly. Women 55 and older should get a mammogram every 2 years. If there is a high risk of breast cancer for a woman of any age, mammograms will begin sooner and continue yearly to possibly detect early cancer. Now, I bet you're wondering, what can I expect during a mammogram? Well, you will have to undress from the waist up. You will have a trained technician that will provide privacy for you and properly position you in front of a machine. This special machine has 2 plastic plates that your breast will fit in between, and the plates will close and apply pressure on your breast in order to get a good picture. And this whole procedure will take about 15 to 20 minutes. Now, I will provide you with some tips to keep in mind before scheduling or going to your appointment. Try not to schedule your mammogram a week before or during your monthly cycle. This is due to the fact that your breast may be tender and swollen during that time. Make sure that you wear something that you can easily get out of, because remember, you have to undress from the waist up. Last but not least, do not wear deodorant or powder. Those products may cause a misinterpretation to the picture that's taken. And remember, for your results, it may take a few weeks depending on your facility.
Thank you, Portia. That was some great information about mammogramming. We're now going to take it to talk about monthly breast exams and how important they are.
Hey, my name is Leanna Shepard, and I'm a student nurse at MDCC, and I'm here to talk to you about breast self-exams. So, all women are encouraged to do these breast self-exams monthly. The way that you want to do this is you're going to use the pads of your 3 middle fingers, and you can do this in the shower. So you just want to apply like light pressure and then medium pressure and then firm pressure all over your breast and then on your armpit area just to check for any lumps or knots. You can stand in front of a mirror, put your arms by your side, and just look to see if you see any swelling or dimpling or like a change in your nipple color. You can lay in your bed, put a pillow under your right shoulder, put your right arm behind your head, and feel on your breast and your armpit area the exact same way you did in the shower. You're going to repeat the same steps on the left side, and you also want to squeeze your nipple to check for any discharge or lumps in your nipples. This is a really good screening tool because women notice changes in their breasts before anyone else does, and it can also help detect early breast cancer. So please remember to do your monthly breast exams. Thank you.
Thanks, Leanna. That was some great information. We're now going to talk about, if you have breast cancer, the importance of getting early treatment.
This is Casey Black, student nurse at Mississippi Delta Community College. Today, I'm going to be discussing the benefits of early treatment in breast cancer. During the early phases of breast cancer, the cancerous cells are usually located within the breast or in the lymph nodes. As it progresses, it can spread. It can spread to even more lymph nodes, or it can spread to the skin on the breast itself. Studies say that individuals that received early treatment for their breast cancer had a 5-year life expectancy higher than those in comparison to the ones that did not receive early treatment. So if you have breast cancer, talk to your doctor about possible options in which you can use for your recovery. Some treatment options consist of a combination of surgery, chemotherapy, and radiation. You can have the entire breast removed, or you can just have the tissue of cancer cells or the surrounding areas. So overall, early treatment is essential for the best client outcome. Early detection equals early treatment, and that increases your chance of beating breast cancer. This is Casey Black, signing off.
Thanks, Casey. That was some great information. We're now going to talk about ways to lower your risk of developing breast cancer.
Hi, I'm Betsy Taylor, a nursing student at MDCC, and I'm here to give you a few tips about how to decrease your risk of developing breast cancer. First, limit the alcohol. The more alcohol you consume, the greater your risk of developing breast cancer. It is recommended that you consume 1 drink per day. Don't smoke. Evidence suggests that there is a link between smoking and breast cancer, particularly during the premenopausal period. Control your weight. Being overweight and obese, especially during your latter years, increases your risk of developing breast cancer, and particularly during your menopausal period. Be physically active. Physical activity can help develop a healthy weight, and a healthy weight helps to decrease your risk of developing breast cancer. Exercising 150 minutes a week helps to decrease your risk. Breastfed. The longer you breastfeed, the lesser your chance of developing breast cancer. And finally, limit your dose and duration of hormone therapy. Hormone therapy for more than 3 to 5 years increases your risk of developing breast cancer. Talk to your doctor about non-hormonal therapy or about limiting or decreasing your amount of hormone therapy. Again, I am Betsy Taylor, a nursing student at MDCC. Thank you.
Miss Betsy, that was great information. Thank you so much. And thank you guys for tuning in to the Mississippi Delta Student Nurses and talking about breast cancer. We hope that everything that we have said has benefited you in some sort of way and that we have taught you some things today. Y'all be safe out there.